Hey guys, Dr. Donahue here. So we've covered the median nerve and the ulnar nerves. Today we're going to talk about the radial nerve. So while it is pretty common to see entrapment of the median and the ulnar nerves, the radial nerve, it's a little bit less common, but we still see it. So just kind of the course of this nerve here, as with the other two, it branches off of the brachial plexus at the neck, but it runs down the back of the arm and then into the back of the forearm and back of the hand. So it has a motor and a sensory component to it. So it supplies the muscles of the triceps and then all of the extensor muscles of the wrists. So the muscles on the posterior forearm here. And then the sensory side of it, it again supplies sensation to the back of the forearm here, into the back of the thumb, the back of the index finger, and part of the middle finger. And typically though, it doesn't go into the tips. That's of the tips of the index and the middle finger. That's more so the median nerve. As with these other nerves, entrapment of the radial nerve is typically from overuse. It's an overuse injury. You know, it can happen from trauma or from something else, but more so it's just overworking, and those tissues start to trap that nerve. And it's usually from repeated supination and pronation, wrist extension, or a lot of gripping. So if you are having symptoms of entrapment of this nerve, you might have pain, weakness, numbness, tingling. Now, the first thing that we always want to do when dealing with any sort of nerve symptoms is rule out the neck. Make sure that the nerve symptoms aren't coming from something like a disc herniation. And if we're able to do that, we can start to kind of work our way down into the common entrapment sites, especially if you're having symptoms into what I just talked about there. So a few common entrapment sites with the radial nerve is at the supinator. There's some fibrous bands that run around the radial head on the outside of the elbow, and at the extensor carpi radialis brevis muscle, which is a muscle that goes down to the middle finger, helps extend the middle finger. But all of these basically are located primarily on the outside of the elbow, where that nerve kind of passes through. So the most common of these sites is at the supinator, which is a muscle with a primary function of supinating the forearm, so that palm facing up towards the ceiling, kind of like you're carrying a bowl of soup. So overworking this so that's why that repeated pronation supination can lead to entrapment of that nerve through there. Now, another more common condition that develops is lateral epicondylitis or lateral epicondylopathy, which is another overuse injury, but more so related to the tendinous portion of these muscles of the back of the forearm, where they become overworked and they're pulling too hard, where they insert on the bone here, and they start to create little tiny micro tears, which develops to pain over time. But lateral epicondylitis and radial nerve entrapment tend to have the same or many similar characteristics and develop in the same manner, the same motions, and in the same ways. So it's important to perform a thorough exam to make sure we know kind of what we're dealing with here. And a lot of times they can actually coexist together. But if you're dealing with one or the other, they both respond very well to conservative care. Treatment might be just a little bit different. You might have to tweak it a little bit. But there are a couple ways that you can kind of separate or differentiate the two. Lateral epicondylitis, if you're just dealing with strictly lateral epicondylitis, typically the pain is going to be more localized and acute right on the outside of the elbow, on the upper elbow, the proximal elbow up here. And usually there's not going to be numbness, tingling, radiating symptoms down into the hand. And usually it's going to be better at night with rest because it's not being worked. And then the final thing with that is a lot of times people will wear a brace, kind of a counterforce brace, which helps to stabilize the area so those tendons aren't pulling so hard, and that will provide a little bit of relief. Now, if you're dealing with radial nerve entrapment, what usually happens is the pain is more acute distally down into the lower forearm and into the hand. You're going to have the numbness, the tingling, the radiating symptoms, and pain doesn't typically improve at night. It's common to see pain last throughout the night or wake you up at night. And then using that brace will actually make it worse because an irritated nerve doesn't like to be compressed. And that's exactly what that brace is doing. So if we're dealing with nerve symptoms or entrapment of the nerve, that sort of brace there is contraindicated. But like I said, both conditions, whether one or the other or they're happening together, they respond very well to conservative care and home exercises. One of the main things that we like to do in our office is use active release technique, which is a specific technique that goes in and goes through different ranges of motion and breaks up adhesions that develop, which could be causing that nerve to get trapped in there and creating those symptoms. So if you feel like you are dealing with any of these symptoms or think that you might have some entrapment through the forearm and are getting some symptoms into the back of the hand, I'm going to show you a super easy but a very effective exercise that you can try out at home to help kind of relieve those symptoms here. So if you're, let's say the symptomatic side is this side here, all you're going to do is we're going to do some nerve flossing, similar to median and ulnar nerve flossing, just a little bit different hand movement here. So all we're going to do is we're going to take your arm and you're just going to reach behind you and flex that wrist down. As you go back here, you're going to bend your head to that same side, and then we're just going to bring it up and bring that head to your other shoulder there. So we're pulling the nerve this way as we go this way, and then we're bringing it back and bending our head to that other side. So again, yeah, we're flossing that nerve, kind of breaking it up from any adhesions in there. Try to knock that out 8 to 10 times, a few times throughout the day, 3 or 4 times a day. You shouldn't, as you're doing this, shouldn't have a lot of aggravating symptoms. A little bit of a pull is okay, but you shouldn't be increasing any numbness or tingling. So give that a try. Let me know what you think. If you have any questions, let us know, and we will talk to you guys soon.